Okay, we're here with part 2 of Triad of Health. This is Graciela. My name is Dr. Ilya Skolnikoff. I'm dressed down for you guys. We're doing casual family treatment here. And yeah, we're just continuing. Graciela was experiencing the feelings of silent scream throughout her life. It's kind of a deep therapy, so we're seeing the changes in her physiology, right? Right. Okay, so whenever you're ready, we're actually going to do another one of those adjustments. This is a little bit like that one, it's just a different bone. Okay, now I'm just waiting for your body. You seem fine, but okay, so we're gonna do that, and we're helping with this silent scream is connected to a bacterial infection that's in the colon. So let's give it a go. Okay, so if you notice when I turn your head that way, it turns okay. You don't help, just kind of relax. In a minute we'll do the adjustment. When I turn it this way, it's not moving as well. Can you tell? Maybe part of it's your tense, but the other part is it's just really not moving too well. Okay, so we're going to do an adjustment. How did it go? Okay, so she's never had a chiropractic adjustment before. We just showed you what a chiropractic adjustment is, and this is only to be done with a person who's a licensed chiropractor, right? You're not wanting a friend to do anything like this, obviously. So every patient's different, but this is just something that is helping her a lot, but it doesn't mean that it would help other patients. So if you're watching this thinking, oh, this is what happens in the Triad of Health Family Healing Center, not necessarily. Lots of things happen here, okay? This is just what's happening right now. So anyway, is that a little bit tender then still? Okay, from the last one? Okay.
No.
Not really. It was for a minute, but okay, so something over here, but not, okay. All right, so you ready for the next one? Okay, so now think about any kind of silent scream happening in the present time. It might have something to do with love or money or relationships. We talked about Claudia, and could have to do with anything, right? Mom, dad, sisters, friends, work. There's other things too, right? Diet, anything, your body, anything. So you're just kind of thinking about that. We're going to do a quick movement. It should be interesting, and yeah, so we're going to do that. So here we go. So we'll adjust Graciela's atlas. So try to let your head rest on my hands. We're doing, like I said, we're going to do this adjustment. It should help with your digestion quite a bit. Okay, good. Okay, glad you liked it. Okay, so the laughing's a good sign, right? So I know from experience if my patients are laughing, they're fine, right? But this is shocking for sure because she's never had these adjustments, and we figured out that I looked at her blood pressure, and I've been given permission to talk a little bit about her health. Her blood pressure goes down, it fails to rise on one side. It's supposed to go up 4 to 12 points going from seated to standing. Her blood pressure stays the same on the left going from seated to standing. So that's not what it's supposed to do. It's supposed to go up 4 to 12 points. And on the other side, it goes up fairly normally. The systolic, the pressure the blood needs to, the pressure that the heart needs to pump the blood out with to the rest of the body, that's the systolic blood pressure. That one goes up normally about 9 points. The other one goes up 1 point. So she is exhausted, but that's not her number one health challenge, her exhaustion. It's more things having to do with blood sugar and emotions and that kind of thing. So anyway, the point is if her blood pressure, that's checking for adrenal dysfunction. When people have really depleted adrenal glands, you don't want to do these types of chiropractic adjustments. Her adrenal glands are depleted, but in a different way than would be contraindicated for that type of an adjustment. So anyway, these are all things that need to be considered when doing a chiropractic adjustment, and that's what we did. We considered everything. Okay, so we're going to move on with our treatment, I guess. And we'll see if we're going to talk to you guys or not about it. But thanks a lot for coming and joining. And go ahead and try sitting up for a second. Let's just see how your head and neck feels when you turn your head from right to left. Does it feel a little different than before? Yeah.
It felt stiff before.
Okay. So we're still going to work on that. We're still working on the bra, so everything is connected. We don't want to just treat symptoms and have a few symptoms feel better, and then as soon as the patient leaves the office walking out, all their symptoms come back because we haven't addressed what's causing them. So we don't do that. We want to address the underlying cause of the symptoms. Like Hippocrates said, the highest good is to find the cause. And if we don't get to the underlying cause of symptoms, then symptoms keep coming back, or some other problem comes up. Okay, thank you so much for coming and joining us here at Triad of Health Family Healing Center. Thank you, Graciela. Thank you. We'll talk to you soon. Bye.